Okay, so hello everybody. My name is Caroline McKeever. I'm the Curriculum Hub Manager for Health and Social Care in Northern Ireland, and I'm based at the Northwest Regional College. I have today with me a very special guest, Michaela Doherty. She's a qualified dental hygienist and one of our very own teaching staff here at the Northwest Regional College. Michaela is here today to share with you all a wee bit about her role in dental nursing and her journey throughout. So thank you, Michaela, for taking time out to have this chat with me. I really appreciate it.
No problem. Thank you.
No problem. I have a number of questions I'd like to ask you. And the first question is what is a dental nurse and what kinds of things do they do?
Okay. So dental nursing, it's a great opportunity, to progress a career in the dentistry profession. And you're constantly interacting with people and helping to assist the dentists and the dental team that works in a dental surgery. You'll be working alongside dentists and dental hygienists and dental therapists in the surgery, as well as carrying out other roles. You've different roles and responsibilities with working in the surgery whenever it comes to being a dental nurse. So you can, you're sort of preparing dental filling materials and other surgery materials for different types of treatments for patients, and assisting the dentists and the other dental staff with the sterilisation of equipment and instruments. You're meeting and greeting patients, every day. Whenever they're coming in for their different types of treatment, so you're reassuring them and keeping them calm, and you get to see different types of patients. So you have your adult patients and your elderly patients and some kids and vulnerable sort of patients and special needs patients. You help the dentist with processing and sort of taking x-rays and carrying out like examinations of patients' oral health, and recording sort of different notes taken from the dentists, and then you're constantly sort of trying to keep a good level of infection control within the dental surgery between you and the dentist and the patients as well. So every day, it is different patients, so it's a different day each day, and there's lots of things that you can do, after dental nursing, after you become qualified. So once you do become qualified, you register with like a dental nurse profession, with a professional body called the General Dental Council. And they sort of regulate your registration and keep you sort of up to date with sort of ongoing courses and stuff that you can do to sort of progress your career in dental nursing. And although it may be your lifelong career plan, one of the benefits of being a dental nurse is that there's so many opportunities, available sort of for the future. You can, progress on to be a hygienist like myself, or a dental therapist, or there's lots of courses you can do, like, applying fluoride varnish to patients' teeth, and you can do special care dental nursing, so specialising in like special needs patients, and you can be an oral health coordinator. So that's sort of going out into schools and different groups and talking and educating patients on their oral health. And there's, as I say, there's lots of other, career progression, sedation nursing, where patients would be under sedation to get treatments for patients would be really nervous. So lots of things to do, and it's a really good career opportunity.
Okay. Oh, that's great. Well, thanks for that. That gave us a really good, a really, really good flavour of the type of work that you do as a dental nurse. It sounds very busy and very rewarding.
It is definitely really rewarding. As I say, every day is different, and no two patients are the same. So it's great to be able to comfort and reassure patients coming in and be in the healthcare, sector. And as I say, you're constantly working with a team and working with the dentist and the team, and then working to help and support patients as well, to put a smile on their face.
Okay. And quite literally.
Yeah.
So how did you get into dental nursing?
So I started off, I finished my A levels at school, and I didn't really know exactly what I wanted to do, but I did apply for general nursing, and then I did a wee bit of work experience in general nursing, but I just found that general nursing just wasn't for me. So I had seen then that there was an opportunity came up, with Northwest Regional College, that they were doing like a trainee dental nurse course. So I applied for the course, and then I secured like a full-time employment as a trainee dental nurse in a practice, and then got accepted onto the part-time dental nurse course with the Northwest Regional College. So I did that for over a year. And then became qualified, as a dental nurse. So all my training was in practice, but I was learning at the same time. So you were able to earn money and learn on the course at the same time, which was great. For students that might need that wee bit of extra income but still want to get a career opportunity.
Well, that's brilliant. And that traineeship is, you're referring to the apprenticeship. Is that what you're doing?
Yeah, so there was an apprenticeship, and there's a new apprenticeship program starting as well. So it was an apprenticeship, and your practice and everything very much support you with that, as well as the college. So it's a great program, and as I say, you're able to earn while you learn. At the college and at your work placement, which is great.
Well, that's brilliant. And it's brilliant, that those opportunities are there, and Northwest Regional College are, we're still recruiting and plan to recruit even more. So there'll be further opportunities and apprenticeships.
Yeah.
I just want to know, just because I'm getting a sense of, a great passion, a great drive from you, in terms of, like you progress then on to become a dental hygienist.
Yeah.
But I want to know, what do you love? What's the biggest thing that you get from working in a dental practice?
So I suppose the first thing is, as cliche as it may sound, is that you're always trying to put a smile on everybody's face. And in the dentistry sector, it's very much patients coming in with negative thoughts and sort of that negativity sort of atmosphere, but because they might be in some discomfort, or just from a cosmetic point of view, they could be maybe embarrassed just with their oral health for different reasons. So there's a number of different reasons that 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 you're able to help those patients. So every day you're sure to leave the surgery knowing that you've helped somebody, whether that being you're taking them out of some discomfort, or whether you've just helped to assist the dentist and given them that sort of smile makeover that they want. So it's, and as I say, you're constantly reassuring them and literally just putting a smile back in their face again, and giving them a better quality of life as well. Because a lot of some patients that would come through, they would see it, as I say, that they're sort of embarrassed, they don't socialize, they have a number of different reasons why they don't be sort of out and about, because of their oral health. So if you're able to sort of make that happen for them and be able to improve their mental health and well-being, as well as their sort of, as I say, physical oral health, then it's a great feeling.
Aye. No, it definitely must be, because like any experiences that I've ever been to the dentist, I can remember early memories of really hate going to the dentist, because I knew that they were going to inflict some sort of pain on me. I was in pain to begin with. I always remembered, lovely dental nurses, being in the environment, and very soothing and very comforting. And I suppose that's a really, for me, it was an excellent, role to have, to be able to be there and just to reassure. You don't. It's just it's an experience. I can remember being in a dental practice years and years when I was a child, and there weren't that many dental nurses then. It may have been only a dentist, and the experience was a fairly different one, because they wanted the job done. But as a dental nurse, you must take some pride in being able to reassure and support that person through it, because it really it's not a pleasant experience.
Yeah.
I don't think anybody wants to run to the dentist every day.
Completely. So you always are making that difference, and you normally are the first person that the patient is going to see when they come through that door. So to come through and for the patient to come through that door and see somebody that can be soothing and helping them, and as I say, reassuring them that everything will be okay and that they're not going to feel any pain, of course, with getting the treatment done. It's a great feeling, and it can be the difference of making the patient be happy and less anxious.
Aye, no, that's right. So I'm going to just move on to a different type of question here, and it's just I'm interested to know if there's any particular challenges that a dental nurse might face. If you could give me an example of one.
Mm-hmm. Aye, so there's a couple of things would be probably time constraints. So in the surgery, it'd be so busy. There'd be so many patients coming through the door every single day. So the dental nurse is sort of literally in charge of getting the surgery set up for the whole day's clinic, and for each patient coming in the door each day. And then making sure that all the equipment and instruments and materials and everything is there and ready. And because as I say, there's a certain time frame between each patient, you're sort of under that wee bit of pressure of making sure that everything's ready and set out and organised for the patient coming in. So probably a wee bit of time pressure, would be the only thing. If sometimes as well patients come through the door, if they are in a wee bit of discomfort, you're obviously the first person that the patient may see, and sometimes you might have the patient that might be just a bit abrupt because they're just in that much discomfort that they feel as if they see you and then they just need to tell you all about it. So and which can be a wee bit it can be a bit abrupt from the patient side of you, but you just sort of learn to be really calm and polite, and just sort of listen to the patient and understand where they're coming from, but again, sort of just reassuring them, just and helping them again. But probably, as I say, just the time pressure of making sure that everything would be ready and organised, and it would be the main thing.
Aye, no, that's brilliant there. It's a really good example, of a particular challenge, and I'm sure there are many challenges, like in any health and social care context, and you've mentioned there, quite a number of skills and attributes. I suppose I'm going to just extend that out now. I'm just curious if there are any particular examples of skills or attributes a person would need in order to get into dental nursing and then to work in this sector. What kind of things would they need?
Aye, so the main thing is sort of professionalism, obviously, with any sort of health and social care sector, but making sure that you're professional and that you can work well as part of a team is really important, because in the surgery, a dentist and a dental practice would not run without a dental nurse. So you need to make sure that you can work well as part of a team. So work with other dental nurses, work with the receptionists, work with the dentist or the hygienist or the dental therapist. Using your own initiative as well is really important, because, as I say, you want to make sure that everything is ready and organised, and then you've all the correct equipment, instruments and materials set out and organised for that particular treatment for each patient. Being sort of really calm and reassuring towards patients and empathetic, is really important as well. So lots of different things. The takes to be a good dental nurse, and as I say, working well as part of a team and being quite sort of caring towards other people is really important.
Aye, and you would get a lot of that coaching and that kind of support whilst you're on an apprenticeship from both your teachers, and then having the practice element included. So you get loads of opportunities and loads of practice
Yeah.
You could come in with being very good and very very empathetic towards people and wanting to help people. But I suppose the apprenticeship then gives you an opportunity to really extend and really pull out those qualities and attributes that a person needs in
Yeah.
order to work in that type of environment.
That's right. So, in the college, you do the theory part of it, and then once you're out in your apprenticeship with the dentist and your mentor, when you're meeting and greeting patients, then you will learn those skills sort of on the job, really. And seeing all the patients coming through each day. So, no, there'll be lots of help and support there, and as I say, that we would do like scenarios and everything in the college as well of simulated patients coming through the door and how to deal with their complaints and so on. So, lots of support.
Aye. Well, that sounds really good. I just want to thank you now just for answering all of my questions. I think you've nearly enticed me to join myself, you know. But you've given a really, really good overview of what dental nursing is and what to expect and how you can get into dental nursing, and then and most importantly, why dental nursing is such a brilliant career choice. So thank you, Michaela, for your time today. I really
Well,
enjoyed this. And I just want to let people know that, if you're interested or if you know of anybody that's interested in getting into dental nursing and would like to learn some more, just get in touch. Contact the Northwest Regional College through our website. And thank you. Thank you all for listening and have a lovely day.
Thank you.